So it's my opportunity to welcome Dr. Stephanie Harper here this evening, who's the Health Director for the Roanoke Facility and Alleghany Highlands Health District. So Dr. Harper, I'll turn it over to you.
Thank you, Dr. Sneed Johnson. It certainly is a pleasure for me to be here with you tonight, and I'm looking forward to bringing you this information that is really a result of the hard work of the community. I mean, this in no way has been a health department project. It has certainly been a project that has required community input and hard work, and that's exactly what has happened. So I hope you'll be able to appreciate that as we move forward. So this project started, I guess now, 18 or so months ago, and it started with the idea that health is really far more than just physical health. Now, I'm a physician, so I certainly appreciate physical health, but if we're really going to make our communities and our families and our individual community members healthier, then we're going to have to look beyond physical health. We're going to have to think about whether or not folks can read and write, so whether we have good schools that they can attend, whether they have jobs, whether they have adequate housing, whether they have safe neighborhoods. All of those things and many, many more are what help define how healthy we are. And so at the beginning of this work, with that understanding of health, we utilize this quote sort of to be our forward vision, so our North Star, so to speak, and it reads, "People working together in a strong community with a shared goal and a common purpose can make the impossible possible." And I would say that this really describes our effort, that as a community we came together with a common goal, that goal being enhance the health of our area. And as we work together to do this, we have achieved success. And so part of that you're going to see from our perspective this evening. And I don't want to go any further without completely acknowledging that this has been a community project. And it was a community project where we just convened all takers, so there weren't any favorites. Everybody had the opportunity to participate. We certainly have appreciated all the participation that came about. But we started off by just saying, how can we bring folks together, like-minded individuals that were interested in making a difference? And these are they. These are the ones that came together, but not just these, right? There were others that have been involved in and out of the work at various times. When we talk about the steering committee or individuals that put time into developing the action plan, these were those that worked in that capacity. And we certainly have appreciated being connected with them. And so this really has been the process. We started out in the beginning engaging the community, trying to form this group of like-minded individuals so that we could then identify a common goal and work collectively for results. We did that. We then spent some time collecting data, and it's my hope, I'm going to advance to this slide, because it's my hope that some of these pictures are familiar to you. We spent some time developing a first survey, which was distributed. We then developed a lengthy second survey, which is represented right here. That was the primary data we collected, and actually before we got into collecting the primary data from community residents, we actually reviewed just about all the data as it related to the Covington, Alleghany area. And we reviewed this data by creating this is actually the front picture of a notebook, and it's one of those big binders, if you know what I'm talking about. So this was a big binder filled with all the data as it related to Covington, Alleghany. So data on transportation and housing and crime statistics and education and health, et cetera, et cetera, et cetera. We reviewed it as a collective unit. And then once we reviewed that data, it was then that we solicited data from the community, which we call primary data, but in the way of these two surveys. So if I go back to this slide, so we collected data. Then once we had all of this data, we had to assess it to see what it was telling us, right? And then once we assessed the data, we prioritized it, and then we developed a plan, and we're now at the point where we need to talk about implementation. So that's the reason why we're here with you tonight. So this represents the secondary and primary data we collected. Ultimately, we distributed many surveys, but we collected for the initial survey 616 results. For the second survey, which was the thicker survey, there were about 460 survey results returned. And then we used that information, so that's the primary data that we collected from residents, the secondary data that we reviewed in that data binder to figure out who and what we wanted to hear more about. And we used focus groups to get more information. So we convened 6 focus groups across the territory. We used all of that information. So that's the secondary data that we reviewed in the data binder. That's the 2 primary survey tools that we distributed to residents and got information back from. That's the information we collected during the focus groups to develop this list of actually it's a list of the top, not even the top 50, but of the 50 issues that rose to the surface. So this is all of them. So from all of that data, from all of the analysis, these were 50. The 50 issues, challenges, concerns, etc. that arose from that information. Now, as you can imagine, it would be wonderful if we could work on all 50, wouldn't it? It would be fabulous if we could. But realistically, that's not possible. So then what we had to do was to say, well, how will we take from this group of 50 and get it down to a usable amount? So we developed these priority categories. And what we said was, let's make sure we're looking across the community at all ages. So that when we talk about prioritizing, we're not just going to prioritize for those 65 and older or those 0 to 5. Let's see how we can prioritize across the community and then make some more decisions as we get further along. So these were the categories we developed. We developed an early childhood category for children ages 0 to 5, a children's category ages 6 to 10, a youth category ages 11 to 17, adults ages 18 to 64, older adults age 65 plus, and then one that we called family, which really meant the family unit, and then one for the community, which was the community at large. That meant the mom, dad, brothers, sisters, neighbors, friends, etc. Agencies maybe, but just the community at large. We really worked hard to try and consider everything throughout the community, so all ages and entities. And so the steering committee at that point then were the first to sort of narrow this 50 down. So we had the priority categories, and then the steering committee, using those priority categories, narrowed that list of 50 down to 14. And so these were the 14 that surfaced as a result of the steering committee work. I hope you can see them. So that's under the early childhood group. We looked at kindergarten readiness, and then, which also included the low rate of grade level reading, and we also prioritized children not accessing primary care. For the children's group, age 6 to 10, we looked at the high rate of overweight and obesity and academic attainment and high school graduation. For youth ages 11 to 17, the priority was the limited teen activities. And that's really interesting because that first survey most of the respondents, or probably about 40 to 50%, were actually young folks. And so this was one of their top issues, this issue of limited teen activities. So the steering committee prioritized that for that age group, and then the high rates of youth involvement in the juvenile justice system. For adults ages 18 to 64, we prioritize limited economic opportunities and limited health literacy. For older adults ages 65 and older, we prioritize the need for increased services to the older adults so that they're able to age in place, and then quality elder care and the inability to afford medication. For the family unit, we prioritize an inability to afford food, and then mental health concerns like depression and anxiety and suicide and stigma. For the community at large, we prioritize insufficient knowledge of community resources and then substance abuse. So that was where we were at our last steering committee meeting, because the work then becomes, well, we've been able to get that group of 50 down to a more manageable amount, but we need to now figure out what exactly does the community want us to look at. Right? So now we've asked the community to help us in the beginning by engaging to be a part of the steering committee, which was wonderful. We got good reception from there. So now that we've got these 14, we need to go back to the community and say, we've sort of tried to do some of the hard work. Now you direct what else we do. So we moved into having these, we called it sort of a big community launch, and hopefully some of you were able to make that one. As it ended up, we were at the Clifton Forge Fire Department on February 6th. We presented the information similar to what you're seeing tonight, and what we wanted to do was inform the community and then ask them to come back with us again to help to vote on the priorities. Because remember, we had 50, we were able to get it down to 14 using the knowledge of the steering committee who had already reviewed the primary data and the secondary data. We appreciate that all 14 are important, but in order for us to really do the kind of work that we would like to do with the community, we need to get the community to tell us what we should do. So we did that. We invited the community back. This was the main question: what are the top 3 health topics that we should prioritize for action? And remember, we're talking about health, but we're not talking about physical health. We're talking about health in its fullness, right? And so this was what the community voted on. And I mean, there was an actual vote. So hopefully some of you participated in that actual vote. We had pennies, make-believe pennies, so we could have everybody put their 2 cents in it, and they had 3 choices, and they voted on 3 of the topics under the 14, but these were the results. So you can see that the one result was kindergarten readiness and the low rate of grade level reading. Another result was knowledge of community resources, and then our third priority became substance use. So with community input, these were the priority for this effort. And so after we get the priorities, right, then you have to figure out, all right, so we know that this is what's important to the community, so what are we now going to do about it, right? How do we move forward? And so I believe everybody has in their hand what resulted from that work. So I want to mention who was involved in this idea of moving forward. Because what did happen was, once we decided on the 14, once the community came out to vote and helped and narrowed it down to 3, we then had to figure out, we wanted to make certain that we had the right folks around the table to help to develop the action plans. And that makes sense, right? So it's easy to sort of sit there in a room and do some of this work and, not be so informed because you're not really kind of on the ground in the community. So we needed to make sure that using the steering committee and the resources there, that we're able to identify who should be at the table when we start talking about these topics. And so for the area of the work that we're here for tonight, these were the individuals who graciously agreed to spend time working on this action plan. And I do mean graciously because we had meetings, we had conference calls. I served on that committee too. I'm there. I served on that committee too. I was really just the note taker and the facilitator. So it was the experts that were working all this out. And they did a fabulous job. And so what you see in front of you really is the result of their work. And I'm not going to go into detail about it. I think that's coming up later. But just know that the goal is to increase kindergarten readiness and early literacy. Absolutely foundational when we talk about the importance and we talk about building healthy people, healthy families, and a healthy community. So it is just phenomenal that this is one of our choices because it is absolutely critical. It's even critical for your physical health, right? I mentioned I'm a physician, so I love physical health. But if you look at the physical health data, folks that do best with managing their physical health tend to be pretty well-equipped educationally, right? That's just what the data will show you. All right, so under this area, this goal, now remember we have 3 areas working, right? So it's this one, it's the work that's happening in community resources or knowledge of community resources, and the work that's happening in substance use, right? 3 important areas. But for this one, the objective 1, and I can certainly read it for you, but you have it right in front of you too. The objective is to increase the number of students who are ready for kindergarten to 90% as measured by PALS K assessment and the Virginia Kindergarten Readiness Assessment. And then objective 2 is by 2022, 70% of third grade students in the Alleghany County Public Schools and Covington City Public Schools will be reading at grade level by the end of third grade as evidenced by results from the third grade SOL. So important objectives, we will be able to measure them, which is also critical. And you'll see on your sheet that we also have strategies and action steps and due dates. So some of that is also for you to help to hold the work accountable, right? I mean, those involved in the work are serious about the work. This launch now is really to update you, to invite you to the work. Right? If you didn't know anything about it and now you know about it, please join us. We have at every part of this done our best to get as many people involved as possible. This is meant to be a transparent process, right? No favorites. If you love the work, want to help advance the work, please be a part of it. Okay. All right, and so with that, I'm turning it over to Diane. Thank you.